Okay, what I want to do is discuss with you what causes kidney stone pain and when you should call me if there's an emergency as you're passing a stone. First of all, kidney stones are called kidney stones because they begin up in the kidneys. They usually don't cause a problem there, not until the stone starts down that chute called the ureter, heading towards your bladder. And even then there's not much of a problem because the walls of the ureter are elastic and can stretch. And there's only fat around the outside of the ureter. So if you've ever seen a picture of a snake that's eaten a rat, it looks sort of like this. Well, that's what happens with a stone as it's moving down towards the bladder from the kidney. Now, the way the ureter gets into the bladder is it passes beneath the bladder, turns 180 degrees, and goes up into the bladder through the floor of the bladder. And at that point, the ureter is not surrounded by fat, but by bladder muscle wall, and it can't stretch as readily. So when stones are moving down the ureter, they can usually pass down fairly smoothly as long as they're not large stones until they get to that last half an inch heading into the bladder. That's where 98% of stones tend to get stopped. And as long as the stone is moving, or as long as urine is getting by the stone, there's no problem with any sort of real pain. The real pain comes if a stone gets wedged, urine can't get by the stone. The kidney's up there, doesn't know there's a stone down below, it's just making the urine, and it puts it into the ureter. The urine goes down to the stone and it stops. That doesn't cause any pain. The ureter starts to dilate and stretch, and urine starts to back up in the ureter toward the kidney. That doesn't cause any pain either. Not until the backup gets all the way back up to the kidney. The kidney tries to swell to hold the excess urine, but now we have a problem because there's a capsule that Mother Nature puts around the kidney that's like a football helmet, and it doesn't stretch. And what happens then is that translates into increasing pressure in the meat of the kidney. And what is the purpose of our kidneys? The purpose of our kidneys is to filter the blood. So if these are blood vessels supplying this kidney, it has a very high perfusion rate. About a quarter of your heart output every minute goes through the kidneys for filtration. And all of a sudden, if there's a backup of urine causing increasing pressure in the meat of the kidney can't be perfused by the blood. And there's nothing more severe than lack of perfusion pain. That's where the pain from a kidney stone comes from. And that's why when you have a kidney stone, even though it's blocking the urine at the bottom of the ureter near the bladder, your pain is in your kidneys, up high. The message of that pain is taken by the nerves to the spinal cord, right at the area where the splenic nerves go out to your bowels to make the bowels peristalse, to make the food pass through your GI tract. Well, all of a sudden, with this severe pain message coming into the spine, there's a short circuit with those nerves that are going to the bowels, and the signal doesn't get there. So now we have a problem with the bowels, and the bowels freeze. It's called an ileus. The bowels don't move. And that thing on top of our bowels, which is called our stomach, that can be filled from food from the night before, or from breakfast, or from gastric juices or saliva that you swallowed, has no place to empty out now. And so the next thing you know, you start to vomit. So people with kidney stone pain have the pain, they have the nausea and vomiting. So you should call me if you have severe pain that causes you to be able to not tolerate this pain with the pain pills that you were given by the emergency room or by me. Number 2, if you get nausea and vomiting that's prolonged and lasts for several hours and you can't even keep liquids down, you should call me. And the third reason you should call me in any time of the day or night is if you have an infection above an obstructing stone in the urinary system that's under high pressure. Bacteria can seed into the bloodstream, causing sepsis, shock, and death, which we don't want to mess with right now, I wouldn't think. So you should call me if you get a fever, and I'm not talking about 99.7. I'm talking about a real fever that's 104. So call me if there's severe pain. You need to be admitted. Prolonged nausea and vomiting, you need to be admitted with an IV fluid to keep you hydrated. And number 3 is if you have high fever, you need IV antibiotics. Those are the 3 reasons to call, and those are the emergencies for a kidney stone and reasons to be admitted to the hospital.